Hello everyone, my name is Sonal Chandalia and I'm the Chief Nutritionist at Dr. Chandalia's Diabetes Endocrine Nutrition Management and Research Center in Mumbai. Today we are going to deal with a topic which sometimes causes a lot of difficulty to all of us on a daily basis. And when a person has diabetes or any other of the risk factors along with the diabetes, which may be sometimes blood pressure or maybe any other situation where they find it difficult sometimes to clear the stomach in the morning, it puts a lot of pressure on one mentally and physically. So what is this situation of constipation and how do we deal with tackling it by the natural way? So constipation is really not a disease, it's only a condition, and it's a kind of a symptom that one faces where one's stomach and bowel movements are not good enough and one does not clear the stomach effectively every morning. It may sometimes be intermittent and may last for a short while or sometimes be quite chronic. So in this scenario, it is considered as constipation when one has only about 3 bowel movements a week or even less than that, where you find that the stools may be very hard and dry and may be very lumpy and there is actual pain or difficulty in passing stool, and you find that your stomach is not cleared very well. So what is the reason for this particular situation, which is kind of a habitual constipation or a chronic constipation that occurs? It's usually because of our lifestyle. If we are a sedentary urban population where we hardly have any physical activity, the kind of foods that we are eating are all refined and processed products, constipation only gets aggravated. It is also due to the diurnal rhythm when it is disturbed, because we do not realize that our biorhythms require us to sleep at a certain time, wake up at a certain time as per our clock, the bio clock that we have. And when we don't do that, we also disturb the timing, and that can lead to an aggravate constipation. Apart from the fact that in our process of life and the hectic life, we tend to not hydrate well or drink enough water. So these are all the contributing factors that can cause the situation of chronic constipation. So what is the positive action that we can take to treat this situation? 100% we need to have an increase in the water intake, not only throughout the day, but it really helps if one drinks certain amount of warm water, especially in the morning hours when you wake up, and sometimes even in the night just before sleeping, because it needs that much time for the water to transit to the intestine, to your bowels, and soften the stool and hence prevent constipation. Also remember that one key factor that needs to be included in the diet is high fiber foods in the diet, which we do not get if we are constantly having only refined and processed foods. So I cannot emphasize enough on the level and the amount of fiber needed in the food that we normally eat, which we tend to forget or tend to take into consideration. So what are the two kinds of fibers that we need to actually consume? It's not only fiber, but it is what we call dietary fiber, where there are two types of soluble and insoluble type. Now the soluble fiber is giving some amount of bulk to the particular stool, and usually the sources are in the form of pectin. And this pectin is obtained from some of these foods listed here, which is like some fruits like apple and banana, also from some cereals like oats and barley, and also from beans. So these need to be included not only as sources of the macronutrients in a day, but also because they need to be consumed for their soluble fiber. And remember that it should be consumed more in a whole grain version rather than a refined version, or even as juice. Like the fruit should be consumed as whole fruits, the oats and beans more in the whole grain form rather than any kind of processed form. Now the second kind of fiber which we know about, which is insoluble fiber, basically will help take your food faster and transit it through the digestive tract in the correct speed. And finally, it will also help in providing the final bulk that we see in the stool. So these mainly will be from whole grains, from most of the vegetable that we eat, which are green leafy and green vegetables, which will contain cellulose, which is non-digestible fiber, but it gives that particular push for the particular foods to be ejected from the body, and that forms the stool. So it's usually the ones which are whole grain in the bran version or the whole grain cereal version, and also certain legumes and also the beans. So if you consider both the types of fibers, a combination of these foods will help both the insoluble and the soluble fiber portion to give you the complete fiber per day. So a good goal that one can achieve of having total fiber is close to about 20 to 30 grams per day from their total food intake. And that is what one needs to keep in mind. So apart from the daily diet, what else do you need to take into consideration? Physical activity and exercise on a daily basis is a must, because movement of the body will also help the movement of the gut. Remember that your gut has to have the right motility to improve the bowel function. And when this gastrointestinal motility is correct and it is not slowed down, it will reduce the transit time of the particular food in the gut, and you will not have chronic constipation. So once you remember this, you will make sure that you are active. You also have the right dietary fiber amount and quality on a daily basis, and your gut transition movement will be perfectly on time, and it will actually work like clockwork. But remember that some of this needs training from a very young age, and in fact infants need to be trained for the bowel movement, because as an adult also you could be facing constipation if you've had some of this difficulty at a very young age. So the toilet training that we say that should happen at a young age is of great importance even for you for the rest of your life. But if one is suffering from chronic constipation and needs to be addressed, then there is sometimes a fiber supplementation that may be given to an individual. And that is usually recommended when there is chronic constipation and one is not getting any relief. So usually this is a kind of fiber in the form of some kind of husk or some kind of psyllium that we normally give, which we know commonly as being any kind of particular softening of the stool happening through the process of this fiber supplementation. And people can take this for long term, but at least even for a duration of minimum of 4 weeks. But yes, caution is needed, because when you increase the dietary fiber even far above than what is required and way above the limit, you might find that you will go into a stage of diarrhea, where the food and the minerals and nutrients will actually all come out of your body and you will not retain anything, because the transit time will suddenly speeden up and not allow time to absorb the nutrients and the vitamins and minerals. So there has to be a moderation even when one is trying to relieve constipation, which is chronic constipation. And the correct dosage of that fiber has to be given and has to be worked out with your healthcare professional. So thank you for listening in. But do remember that one needs to be treated for chronic constipation. Please take the correct advice and do so, because even when you have diabetes, remember that your gut transit time reduces. The foods go down more slowly. We call it that the peristalsis of the gut slightly slows down with long-standing diabetes. So do help yourself the correct way, and you do not need to suffer, and it can be resolved.